So good afternoon, everybody. Welcome to the Big Data Conference, and again, for those organizers who give us the opportunity, thank you very much. And I'm so pleased to be here with my friend Sam King. My name is Srini, Madala. For the last 2 years, I've been involved in building Aquila systems, which is meant for fraud. We have software for identifying, detecting, and addressing fraud in insurance and workers' comp industry. Prior to that, I have built a company called SoftSoul. It's at three companies in India and also here. For some time, we had a branch in Europe as well. My specialization is building solutions that are unique to enterprise and also large government organizations. Some usually products that are solutions that are not easily available in the marketplace. In the last 20 years or so, the companies I built, and I sold about $300+ million worth of projects, and we executed from beginning till end. And in addition to that, I have some philanthropic interests. I have founded an organization which basically takes care of lots of things that people in rural India needs, including vocational training and also education and healthcare. That impacted about 500,000 people living in 10-mile radius. In addition to that, I'm also active in civic duties such as city government and also being on the board of KQD, public radio, and stuff like that. And
to give a little of my background, my name is Sam King. I'm a vice president for Employers Insurance Group. I'm vice president of their fraud investigations area. And I've been in the fraud investigation world for many years. Prior to being at Employers, I was with Liberty Mutual Insurance, and I ran their fraud investigations program for one of their large companies all throughout California. I was over their whole California operation. Prior to that, I was at Travelers Insurance, and I was the director of their Western United States, 13 Western states, of their fraud program for insurance. I've also been in law enforcement, and I kind of missed some things there, but I've run the two largest national private investigation firms that are national in all 50 states. I've been at both those companies running those operations as the chief operations officer too. So
you've been a president of Anti-Fraud Association.
Yes, we also have there's an anti-fraud alliance in Northern California, based out of Northern California. It's probably one of the premier training organizations for insurance fraud. And I've been a member and on the board for that organization for several years now. So that's another organization as well.
Yeah, I attended a couple of those conferences, and Sam has been a great contributor and well respected in the industry.
And most recently, the reason I'm up here is because Srini was hired, his company was hired, and I'm a client of, I'm one of Srini's clients for his new firm, Aquila. So, thank you.
So Sam, for the benefit of the audience and for those of people who are not fully aware of these things, could you please educate a little bit about workers' comp insurance? What does it mean and what is it meant for?
Workers' compensation insurance, I'm sure you know a little bit about it. If you have a company, you have to know about it. It's mandated by employers by all states. You have to have workers' compensation insurance to cover any injury that an employee may have while at work. So if the injury arises out of employment or occurs in the course of employment, then they would be covered. And typically what it's mandated to cover their medical cost for that injury, for all of their billings and medical costs that we care. It's also, there's also an indemnity feature where it basically covers their cost if they can't go back to work. So an injured worker would not be able to go back to work, then they get compensated for their normal wages through the work comp system. And at some point, they could be entitled to a permanent disability and or rehabilitation expense as well. So those are all features.
For people like us who work in the software industry, it may not be that important, but then for those people who work in jobs which are likely to have causing injuries such as roofing and construction and firefighting and police people and such jobs, it's lot more prevalent.
Right, right.
So, the kind of fraud that goes on in workers' comp insurance, my understanding is wherever there is money, there are multiple transactions involved, the fraud is likely to take place. The more money there is, the more likelihood of fraud occurring, right? What are the types of fraud that occur in workers' comp industry? You can just summarize a little bit, and also the size of it.
Well, and we're looking at in billions of dollars, 7.2 billion is what the National Insurance Crime Bureau has basically said is the amount of fraud annually occurring in the work comp system. If you look at just the property casualty system, we're talking about $30 billion. If we're talking about auto, property, other types of insurance, including general liability, those type of things. If you add healthcare into it, you're going to get into the 400 billion maybe. I mean, in some cases it's been said to be over $1 trillion problem in the healthcare industry. So it's a real problem. We address three areas, three types of, in the work comp industry, we look at three areas. One is we look at provider fraud. Provider fraud is one of our biggest problems. And this is anybody, including a doctor, a medical doctor, a chiropractor, copy service company, a private investigation firm, it could be a interpreting company, anybody billing a claim file, okay, that is a provider of services. Those are real problematic right now, and so we're focused on them. That's one area. Another area is premium fraud. Premium fraud is where we have policyholders that might try to get a less than proper rate for their workers' compensation insurance, and they can do that in various schemes. They can misclassify employees, say they're janitorial workers when in fact they're construction workers, that type of thing. Or say they have clerical workers when in fact they have, food service workers or something like that. So premium fraud is a real prevalent problem. And then the other aspect is claimant fraud, and that's actually injured workers that possibly do not want to return to work, and that happens, or they decide that probably 80% of the fraud that we deal with injured workers is where they don't want to return to work, and we find out that they're doing very strenuous activities and recreational activities. Yeah, they're sailing on those sailboards in Hawaii or whatever, and those are, we get them on film. We do surveillance, we do undercover filming, and we find out that they're able to do the activities that they're claiming they cannot do.
So, Sam, you're the Vice President of SIU and Special Investigative Unit. Could you educate a little bit about what an SIU is and what actually you guys do in SIU, and how is that related to insurance companies or carriers?
The SIU term is Special Investigative Unit. It's very similar to CSI, except I'm not in the movie business. Basically what we are is we're mandated. We're it's a very unique industry. We're the insurance industry, one of the few industries that is mandated by law to have investigators with proper experience to investigate fraud. Okay, so we have to, by law, compliance-wise, have investigators to investigate criminal fraud. And that's what we are with the Special Investigative Unit. It's composed of fraud analysts. It's also composed of fraud investigators. We have in many states, and we cover 48 states. My company is currently in 48 different states. So half our business is here in California. We're big in California. We started here, and the other half our business, revenue-wise, is in the other 47 states. So we're going into all 50 states. But long story short is that in California, we're required to report fraud not only to the Department of Insurance Fraud Division, and they have fraud investigators. We're also required to dual report to the local district attorney's offices. So we work directly with prosecutors. We work on these cases. We have to submit annual reports on how many referrals we made, how many documented referrals we've put together as far as evidence, and we do an annual reporting for an SIU compliance report as well.
So if I understand it right, you have those three types of fraud, and then you have SIU who actually deals with the fraud. And typically, these are the traditional tools that you have. Traditionally, last 20, 30 years, you've been fighting fraud. And if I understand it right, you have tip-offs, then you get a tip line, maybe 800 line, or people cite anonymous letters or mail or something like that. And then you have surveillance, which we actually use devices to actually record different things going on that you suspect as fraud, and investigators.
Right.
You have actually performed all of this and supervised those divisions before, right?
Right. These are the main traditional tools. I mean, they're the broad brushstroke of traditional tools that we have. And we publicize posters, 1-800 numbers for reporting fraud, so we can try to get people to give us a tip that there's a fraud problem. But this is the traditional tools.
Right. So can you explain a little bit, maybe one or two examples, real life cases that actually happened in California, giving an idea of the sophistication, the complexity, and the magnitude of fraud, so people can understand and relate to some of these things?
I wanted to share a couple of examples. This first example is it's a $200 million fraud scheme that occurred in California. It started in Southern California. It was throughout the state of California, but it started in San Diego County. And what it was a company called Central Legal. They would market. They had a joint advertising process with numerous attorneys in the work comp system, and they would advertise for those attorneys under an advertising fee. And they had a call center in El Salvador, and they call El Salvador through their marketing efforts. And what they were doing is they were convincing people that were employees of any company, they didn't care which company, of any company, to file a fraudulent workers' compensation claim. To say they were injured, they were saying if they did say that, they would get all kinds of benefits, they would get money, and they were basically trying to get these people to file these false claims. They did, and they would sign up, they would send out a sign-up agent to sign up that injured worker to file the legal paperwork for an attorney, and then that attorney would put the insurance company on notice. And then these people that ran this joint advertising company, they started controlling the medical care. So they would also send not only that injured worker to the attorney, they would send them to various medical doctors and to other service providers, physical therapists. They would provide the interpreters. They would also they owned three copy services. I'm sorry. These same individuals, so they'd have to copy all the records and bill the insurance company for those records. So ultimately, the insurance company would pay for all of those. This scheme is it's actually 200 million. That's a small number. It's 200 million of what they caught and criminally are prosecuting right now. The two individuals that started this operation pled guilty. They've been filed on the federal court system, and the Southern Federal Court District filed on them in California, as well as the San Diego District Attorney's Office. And there's 10 attorneys being prosecuted right now by the Orange County District Attorney's Office and other medical providers. So this is one example of this was basically they were getting kickbacks for referrals and getting fraudulent claims in the system.
Basically, the attorneys are not supposed to get referral fees. They broke several laws, and then they kind of manipulated the system in such a manner they ended up milking $200 million at the minimum.
Yeah, no.
Second example is
another example. This is a multi-million-dollar kickback scheme as well, and this is a kickback for referrals. And this was a chiropractor named George Reese who would. He would get a work comp patient, an injured worker, come to him, and he was actually involved in the other scheme where he was getting false injured workers, injured workers who did not have that had fraudulent claims. And then what he would do is he'd send them to, every injured worker would be sent to a company called California Imaging, which is an MRI, they would get an MRI, whether they needed it or not, they'd get an MRI, and they would bill for that MRI to the insurance company. And then once they received their monies from the insurance company, they would, they set up 3 different entities to funnel money to as a mediary in order to pay back the chiropractor and give him a kickback for sending them the patient. And this was this went on for several years before it was uncovered. But a major fraud scheme. And then the second part of this indictment, there's 3 parts to it, is the chiropractor. He's already been prosecuted and has pled guilty, and all these individuals. But George Reese was the chiropractor. He also would refer.
This is the real gentleman.
This is the real gentleman. You can look it up. George Reese would refer every patient to Foremost Shockwave Solutions, not only to California Imaging, but now to Foremost. And basically, it sounds real exotic, you know, Shockwave. But what they would do therapy that was electric impulse related therapy, and they would bill $2,100 for every shockwave treatment to the insurance company, and when they're paid, they would have an intermediary and pay back and give a kickback to the same chiropractor. And then the third indictment, same individual chiropractor, he would send everybody to the same attorney. So the attorney would bill about $5,000 representing that claimant and receive about $5,000, and that was a smaller kickback of $50 per patient. But that was also through an intermediary. And
although it's a small amount, but the number of patients being referred each month generated a recurring stream of revenue for the chiropractor.
Yes, in the multi-million dollars. Yeah, it's a you know, this wasn't a couple patients. Yeah. This was thousands of patients.
Right. So I think, you know, after looking at some of these examples, these are real life things, and this is not in the 10, 15, 20 years ago, these are more recent ones. Some of them actually are going through the trial right now. So what changed is I've been very fortunate. My company, SoftSoul, have been working with workers' comp industry for about 15, 20 years. You know, Ashwin has actually, you know, been with us for that long, and he actually developed some solutions for workers' comp. And we found out that actually, with the change in technology, the new technology, cloud and analytics and big data and AI coming in, by the time these things were incorporated into the solutions, there's a gap, and then we took advantage of it. 2 years ago, we started Aquila Systems, realizing that there's this big data, cloud, analytics, AI. We could put it together and make use of it to solve these problems. Some of the problems that we try to address this fraud using the traditional approach are a little harder and expensive, and sometimes impossible. I can give some examples of that. For instance, in general, in fraud, you can prosecute anything, but it costs you so much. The time to investigate, time to put it together, and prosecute, there's a cost to it. If the cost is so much higher than the cost of transaction that you're trying to chase, then it may not be worthwhile doing it. But if the technology makes it possible to do it cheaper, faster, easier to do it, then the whole thing it changes, and that's what exactly happened in this case. So so in the 3 examples Sam gave, if you look at it, previously when we talked about 3 types of fraud, there were 3 actors. One was the providers, which are people who are billing the insurance company for money. The second one is the claimant, him or her, so individuals who actually are employees. The third one is the businesses which are actually cheating on the premium. They were doing high-risk business and getting a discounted premium, categorizing themselves as a white collar, something like that. But when you actually looked at the example Sam gave, the 2 people who got the richest in exploitation of this insurance scheme of 200 million are not the doctors or lawyers or the brainiest people. They got some money, but they're not the guys who got the most money. These are most probably uneducated, unsophisticated. You never would even suspect them. They own copier companies. So it's like one of those old movies where you have the super boss sitting somewhere in a wheelchair. He has no limbs and even paraplegic, and sitting there, he could be the boss, running a underworld mafia, the most powerful guy. In the same way, this fraud, it manifests in so many ways, and so it's very difficult to track it down to go there unless you have, some kind of sophisticated tools. So Aquila, for example, we actually named Aquila because in Spanish, Aquila means eagle. You need a sharp eye like eagle to sift through lots of garbage and lots of paperwork and all these documents to find out where exactly you should focus on. So we have interesting, we have different modules. One of it is link analysis. The link analysis goes through this, for instance, in employer's case, Sam's system, they have 5 years of data, which is close to 60 million records that are there. And we have to gather information from that and then identify patterns where there is likelihood of collusion. Most sophisticated scams do not happen individually, they actually in a group fashion. Usually the same actors are there in more than one plane because they're very popular or they're good at it. So link analysis would let you do that. And similarly, different modules we have and which basically allow SIUs. The SIUs have two different duties to perform. One is they have, you have the obligation to work with the department, district attorney's office and insurance crime bureau and to report and to work with them and collaborate with the cases that they already began. Right. And the second one is to actually identify suspicious characters and come up with fraud so that you can prevent the fraud, and also you can, fortunately fraud has a statute of limitations which is a little bit more liberal than traditional civil cases.
Right. Typically, we have, in a criminal arena, we have 4-year statute of limitations. So from the time the fraud occurs, we have 4 years to prosecute criminally. So it's a long tail statute of limitation. And in some cases, that can be even longer, depending on if there's a pattern of fraud that was going on. The other aspect is we can pursue fraud on a civil basis. So if we have a multi-million-dollar fraudulent scheme and we've paid monies, we can go after them civilly. And it's a lot easier to prove civilly because we only have to we only have to prove,
burden of proof is
burden of proof is easier. It's beyond a preponderance of the evidence versus beyond a reasonable doubt in the criminal arena. So it's also easier because we only have to have three-fourths of the jury agree if we had a jury trial versus all 12 jurors agree, like you had in a criminal fraud case.
So basically the traditional versus now, I think the leverage is significant. Sam, do you want to say something on how easier it was, or actually maybe we can cover this and then we can go to that one.
Right.
Use cases, maybe some of the use cases that.
Let me go through some of these. We basically have built in what we brought in subject matter experts to work with Srini and his company, Nashwin, and come up with various use cases, which are really, how do we identify fraud? How do we identify, insurance fraud? So we came up with several use cases. These are categories. We came up with suspicious connections. Srini was talking about that through a link analysis. And looking at suspicious connections, we know that certain individuals who refer to each other, this could be something that we're going to look at and try to understand what those connections are. We couldn't see that before. We could see them open up a claim file with the hard documents. We couldn't see the amount of connections.
You can also graphically look at the connections between different actors. And also by clicking, you can even find out the number of transactions as also the magnitude of the trade that occurred between these two parties.
Yeah, it's the amount of information we're able to get. And like Srini said, we have over 60 million records. I mean, that we can look at now is tremendous. Another area, a use case, is double billing. We have a lot of providers that will bill us more than once. They'll bill us 3, 4, 5, 6 times. We can see, and they'll bill us for the same data service multiple times. So we get 2 bills with different invoice numbers, and we can identify those very quickly now. Excessive testing, that's one of the provider areas where they add on all kinds of tests. The way we looked at our data before, we had bill review companies, we have other types of companies, but we don't look, bill review companies looking at an individual bill. And we might reduce that bill to a fee schedule based on what's allowed, but they don't look holistically across all claims as to what's going on, or they don't look at the frequency of the billing either on claims. So this is something we can look up now. Upcoding. Upcoding is something that's very common in provider fraud, where they'll use the wrong code because they get paid more, okay, on the billing codes. Or unbundling is very much like upcoding, that it's separating codes and billing for 2 codes versus billing 1 that would be a cheaper code. Treatment for services not rendered, that's very common, where basically we have providers, we have medical doctors, we have chiropractors, we have various types of providers that will have an injured worker sign their name 20 times on a sign-in sheet at different places. They'll have like 20 different blank sign-in sheets, and they'll have to sign 20 times so they can show that they were there on that day and they were actually never there. Okay, and that happens quite a bit. So treatment for services not rendered, unlicensed services. We also have built in a tool where we can look at medical board licenses, we can look at chiropractic licenses, we can look at all professional licensing and be able to identify, are they properly licensed? You know,
and this is one such example where previously it was so difficult to implement. Now we have this 60 million records, but then every week we get like, so many thousands of news claims coming in. But then, there are thousands of physicians and care providers, medical care providers in California. You never know who's being suspended, who's being debarred each day because, for whatever violations they occur. So we have interfaces with external systems, and then when a particular physician or somebody, is suspended, license is suspended, they're not supposed to do anything during that time. If a service date happens to be the date when the physician was under suspension or debarred, previously it was so difficult to find out, in the traditional world. And now, it's so easy for us to, put a stop on that.
Yeah, this is the automation of this process is an incredible value, especially in the not only just the licensing, but also in the corporate licensing.
Right.
Because if you're a corporation and you're not licensed, you're going to have the same problem.
Thanks.
Real quickly, I want to go through real life fraud alerts. We have a treatment received on these are use cases, but somebody that's being treated on a Sunday or a public holiday. We were able to identify, if a doctor's office is not open on a Sunday or a public holiday, very rarely. So that's a red flag for us. We're going to look at that. We can drill down and look at that. We can also look at, if a injured worker is treating with a treating physician over 75 miles from their residential address.
So you have a bunch of doctors
that's
nearby,
a red flag.
but you ignore all of them and you go 75 miles away.
Exactly. So it's a red flag for us because, if it's in a city, there should be a doctor much closer. The other one is level 4 billing. There's a CPT code, current procedural terminology code used. These are the bill codes used for billing us. And we use the American Medical Board as American Medical Association's billing code process, and that's what Medicare uses. That's what the federal billing uses, and healthcare as well.
Yeah.
Yes. So a 99214 CPT code is a type of billing for a level 4 existing patient. And we get, if you have a level 4 or level 5 billing, those billings should only occur about once a month if you have a very serious injury where somebody's hospitalized. If they're not hospitalized, you might see a level 4 billing about every 3 months. We are able to now look at cases where we're seeing on routine claims, no hospitalizations, but level 4 billings on the same claim 2 to 3 times a week. Which is totally fraudulent. And so we're able to identify that, pull that out. Another example of real life fraud alerts.
Well, the fraud evolution has, it's interesting how we all started with 20, 30 years ago, everything used to be manual. And then people started surveying, if a claimant was, suspected to be lying or whatever, they would actually go and do the surveillance. the thing with that was very expensive, very time consuming. And then came the automation using reports and computers and all that stuff. Now, with the cloud and AI, and I think the level of sophistication has gone so much that if you really have the will, you can capture every single transaction at the second level. At the very second a particular transaction occurs, you can capture that. You can capture huge amount of data. You can capture, depending on what your intent and how serious you are, you can really proceed to that extent. So we are very fortunate to have evolved to that extent and the tools and technology that exists today. So,
we have 10 more minutes, so take your time.
Oh, we have 10 minutes. Okay, great. So, so the value proposition, Sam, I think maybe I will take a quick run and then you want to comment on that? Or, okay. So we have about 20 plus built-in fraud indicators. For those of you who want to know what a fraud indicator would be, like for example, if you're speeding, you get a traffic ticket, that you could call it a fraud indicator. But then the fraud indicator by itself may not mean much, but in conjunction with other, data and in the context, it can be extremely helpful. For instance, if you get a speeding ticket, it's just a speeding ticket. But then if the guy is taking a car that's stolen, that means very different. And then if it is the 10th offense of him, that's very different. And if the license was suspended, it's even different. So basically, you can imagine the possibilities, right? That's the kind of thing that we're able to provide. And then we provide actionable insights, which basically means, when a vice president of fraud comes in, opens a system, previously they rely upon tip line, but now the system can actually go through all these things and prompt them, watch for these providers, and this is the reason why you should look for. And there is a potential 50 million fraud, potential 5 million fraud, and for these reasons. So it helps them prioritize their workload, pay attention to what is important for them. And that is done through, identifying the suspicious connections and all that stuff.
And one of the things with the actionable insights is we're able to actually triage, what we have limited resources sometimes with our staffing, with cases we're currently working. But we want to we can triage, where is the greatest problems at? So we can triage that and look at it and be able to see, okay, wait, we've got a $50 million fraud scheme going on here. That would be a target over a $100,000 fraud scheme. So we can triage that very easily by looking at the data.
So the return on investment, I guess we can classify that into two broad areas, Sam. One is the operational part of it. You have X number of resources. There are certain mandatory things that your SIU is supposed to perform in terms of working with the DA, District Attorney's Office, reporting, compliance, that kind of stuff. Another one is identifying fraud where you can actually save big bucks for the organization. So maybe you can comment on those.
Yeah, I think those categories are correct, and I think it's from our experience, we've already had we implemented this tool about 3.5 months ago, 3 months ago or so, into production. Okay, we've been working on this tool for about 18 months, but we implemented it into production about 3 months ago. We've had access to this tool since about October of last year, so we've had a little bit, into the development tool. And since, give you an idea, a couple things. One is just because we had access, we saved hard money, over $3 million since working on this project, in hard money that did not go out the door that would have been paid otherwise, just in this fraudulent, identifying fraud. On the other side, I can give you, we've got a case right now that we just came up with in early June, and in 5 months this year, we have a fraud case that's $19 million in billing fraud in 5 months, and we would have never identified this case had it not been for the tool. I mean, this is the ROI is going to be, we haven't even really tested it out because we've only been in production for 3 months with the real tool, the full-blown tool. So, but it's tremendous. The other aspect of an ROI is just the time saving from the manual. We used to have to hire people to help get evidence and pull evidence together and find it and dig for it.
Right.
And now we can actually, we don't have to hire and have as many people and as many manual hours digging for evidence and digging for information and attempting to get that information. So that's another aspect of that.
That's great. So I think with that we conclude our talk. Hopefully it has been some use to you guys and interesting as well, because it's a real life cases that actually happened in California. So if you have any questions, please feel free to ask.
Can you hear me?
Yes,
Yeah, thank you. Great presentation.
thank you.
There are two sides, right? One is the detection of wrongdoing. The second thing is how do you also strengthen the provider network? What are approaches that you're taking so that you can be sort of balance both sides?
Oh, I mean the prevention of the
Creating
fraud.
trust in the provider network, and the other side is to find out what's
Right,
going
right,
on, right?
right.
So it seems to be a lot more emphasis on one.
So, yeah, exactly. So basically, if I understand your question right, this is about fraud detection. You got that part, and then you want to understand what are we doing with respect to fraud prevention. Is that right?
Or even giving tools to the providers so that they are either not sucked into it unwittingly, or
Yeah.
they have the tools to understand
Correct.
that something that they're doing is
Right.
fraud.
You want to answer? Say something.
I think I understand your question, but so two aspects is what are we doing to prevent like warnings to these providers? Or is that what you're getting at, or
Yeah, it could be that. It could also be just self-calibration.
Right.
The wrongdoing can be both intentional, it can also be unintentional.
Right.
You're getting sucked into some kind of a scheme, and you may be unaware of that one.
Right, and there's a couple different aspects to it. Sometimes we do have providers that we're identifying in the system that are not necessarily criminal. They're just not doing things properly, and maybe they're overbilling, they're doing things, but they're not properly doing things. And we can do, there's education in those situations. The ones I've been talking about today are actually providers that are committing, this is organized crime, they're committing criminal fraud. And this is a major organized crime situation that we're dealing with these providers. And it's still rampant in California. There's all kinds of open cases going on and cases that we're finding ourselves. So these people, it doesn't matter about prevention. We're not going to prevent them. They're going to try to steal money.
Right.
This is just like somebody trying to break into ATMs.
Actually, the people who engage in fraud is not a huge percentage-wise. It's a small percentage. But those folks, I mean, you can prevent it, but I think if you focus too much on prevention, it will still not be effective because they are known for doing it, they will do it. But the best thing is to, kind of judiciously apply, resources properly, because the SIU as well as the company has certain amount of budget, whether it's fraud prevention or fraud, catching the fraud. Fraud prevention, there's actually hybrid approach is what is needed. One is the education, as you said, and the other one is controls for deterrence. Like, for example, we actually have a scoring system for provider. We didn't go into those details because the provider module, we have a scoring system. And then when the bills come in, the providers who are known to be, just like your TSA pre-check when you go to security at the airport, we trusted travel like a trusted provider. Those claims go through quickly, and other people's claims go through a little bit through scrutiny. And we also have controls in place where previously we have a blacklisted provider, they would go and start another company. Now we have, our solution has a mechanism where, if the actor is the same person, the DNA is the same, no matter which, avatar they have and they come in, we are likely to catch them. So these are all the kind of things that are happening now, which were not available before. The modern technology allows us, for example, we have interface with Secretary of State, where any corporation, LLC or S Corp or C Corp is registered there. So we get to know all the officers of that. If an individual provider was starting a company, closed down, he starts a new company, no matter what role he has with another company, he or she, we will be able to sniff that. And that new company automatically get flagged as well. So there are so many controls which we didn't go in detail because of time and other reasons. But there are a lot more things that we're implementing, both for prevention, and also for catching them.
Yeah, and I agree with that. Most of the prevention is going to be educating those people that are kind of in the abuse category. They don't realize it. So sometimes they are billing and they don't realize they're billing wrong. And so, I mean, and we do a lot of training, and a lot of that is just in-person training or group training. But a lot of education is by getting communication out to those individuals and to those providers.
Thank you, Sam. Good job. Thank you.
Thank you.
Thank you very much for coming.